What was Galen's view on anatomy? Have you ever wondered how ancient physicians understood the human body without modern technology? One of the most influential figures in this realm was Galen, a prominent physician in ancient Rome. His views on anatomy were foundational for medical knowledge during his time. Galen believed that anatomy was the essential basis for all medical practice. He thought that to treat illnesses effectively, one must first understand the body's structure. However, there was a challenge. Roman laws prohibited human dissection since around 150 years before Christ. This meant Galen could not study human bodies directly. Instead, he turned to animals for his research. Galen conducted dissections on various animals, including Barbary macaque monkeys, sheep, goats, pigs, and dogs. He assumed that their anatomical structures were similar to those of humans. Through these dissections, he made significant contributions to our understanding of anatomy and physiology. For example, Galen clarified the structure of the trachea and demonstrated that the larynx is responsible for producing sound. He also explored how the lungs work during breathing. He explained that the lungs expand, and the diaphragm and abdominal muscles play crucial roles in respiration and voice production. He observed that airways change size when we breathe in and that the nose warms and filters the air entering the lungs. Galen's views on anatomy were closely linked to his ideas about how the body functions. He saw the body as composed of three interconnected systems. The first system included the brain and nerves, responsible for sensation and thought. The second system was the heart and arteries, which he believed distributed life energy. The third system involved the liver and veins, which he thought were essential for nutrition and growth. Galen believed that blood was produced in the liver and carried by veins to nourish the body. He thought some blood mixed with air in the lungs and passed between the heart's chambers through tiny pores. Although this idea was later proven incorrect, it shows how he tried to connect his anatomical observations with physiological theories. In practical terms, Galen applied his anatomical knowledge in his role as a physician to gladiators. He treated severe injuries, which gave him first-hand experience of the body's structure and its response to trauma. His work laid the groundwork for medical practice in ancient Rome and influenced medicine for centuries. Galen viewed anatomy as the cornerstone of medicine. His reliance on animal dissection to infer human anatomy was a response to cultural and legal restrictions. His detailed observations and experiments informed his understanding of human anatomy and physiology. This knowledge shaped Roman healthcare and continued to influence medical practices long after his time.